Welcome to those of you who are just joining us on Facebook. Quite a large number of people are registered for this and already in the room for our ceremony. Let me show you what that looks like. So in the room in which we are going to hold the commencement event for the first exercise in the COVID-19 Peer Hub, you can see there are already quite a few individuals. I'd like to invite those of you who can to turn on your, if you will turn on your, if you'd like to and are able to turn on your webcam. See, I still have some, and we'll be starting in just a few minutes. So, and looking forward to this event with you. You can see we're just 5 minutes away from getting started, so make sure your connection is working properly. If you're in the room, make sure your headset and microphone are working properly. If you're on Facebook, get ready to introduce yourself in the comments. Don't forget to tell us what city and country you're connecting from. We'll start to share those on screen in just a few minutes. See you in less than 5 minutes. Warm welcome to all those of you who are joining us on Facebook or in the room where the today's ceremony will be held. So for those of you who are not really sure what this event is about, we're celebrating the first 6 weeks of the COVID-19 Peer Hub, in which more than 3,900 immunization staff from all over the world join hands to help keep vaccination going during the pandemic. And today we're going to award certificates to those who have completed the first exercise in the Peer Hub, but also let me just honor, share and celebrate the collective effort of health workers all over the world who, despite the challenges posed by the pandemic, continue to work every day to protect children from vaccine-preventable diseases. So we'll see you in just over 2 minutes. Welcome. Do introduce yourself. Tell us what city and country you're connecting from. Share your thoughts if you've been part of the Peer Hub or if you would like to be. Let us know how you're doing. Let us know what is happening with your immunization work, where you are working every day tirelessly to keep vaccination services going. See you in a minute.
Hey,
warm welcome from Geneva, Switzerland, to all those of you who are gathering here from all over the world. You can see in the hall of ceremony, where we will be having the commencement event, the first one of a series for the COVID-19 Peer Hub. Just a reminder, the Peer Hub is about sharing experience, spreading ideas, good ideas and practices, and taking action to keep vaccination going during the pandemic. Today, we're going to be honoring, inviting, sharing, celebrating the collective effort of health workers who, despite all of the challenges posed by the pandemic in recent months, continue to work every day to protect children from vaccine-preventable diseases. For those of you who are joining us on Facebook, a warm welcome to you. And you can see actually it is the Digital Scholar Facebook page, and really important, if you'd like to be kept abreast and keep up with all of the things that are happening with the Peer Hub and other learning opportunities from the Geneva Learning Foundation, make sure that you not only like the page, but also that you follow and see first in your news feed what we share. We try not to overshare. You can always ignore it if you're too busy, but this is the best way not to miss what we're up to. So today we're going to be awarding certificates for the first phase of the Peer Hub, what we call Exercise 1, with me, and you can see there is a large number of individuals, participants, members of the Peer Hub to whom we are going to award certificates today. We'll be reading the name list and displaying the certificates by country. So every country will be honored today in today's ceremony. And I would like to indeed invite, many of you have not waited for me to prompt you. You are able to turn on your webcams. For those of you who can, we know not everyone can. And you can see there are many who are in the room today, literally from all over the world. Welcome to all of you. Now, we're not starting from scratch. A few months ago, in February, we held, right before the pandemic really grew worldwide, we celebrated the network, the platform of more than 15,000 immunization staff from 90 countries who had already begun to work together on immunization to improve immunization program performance. A remarkable thing has happened in the last few months is that this network has grown by more than 10,000. So where it took us 4 years to get to 15,000 members on our platform, in the last 2 months, we've added another 10,000 members, and I want to warmly welcome you. If you've discovered the Peer Hub or the Geneva Learning Foundation and our immunization program in the recent past, I want to especially make sure that you are warmly welcomed, and there's an entire community that will be warmly welcoming you as well. Now, let me just change a couple of settings here. Here we go. Now, what binds us together is not only the fact that we are immunization professionals, it is also the Immunization Scholar Pledge for Impact that you can see here on your screen. So every member in the Peer Hub, every participant in the Peer Hub is working on COVID-19, during the COVID-19 pandemic, how to keep immunization services going. To clarify, there is no vaccine that's been proven to be effective and safe against the coronavirus, but vaccine-preventable diseases have been affected by the consequences of the pandemic. We'll be explaining that, and you'll hear firsthand from immunization professionals exactly what has happened and what have been the consequences of the pandemic for vaccination, for immunization efforts. Also want to recognize here, you can see that initially we were in the middle of the Teach to Reach program, and want to recognize the commitment and support of the Teach to Reach International Advisory Board. You can see the members here, maybe a little bit too small to actually see it, but you can find the list on our website. And they helped us really navigate and figure out how to pivot so that we could call on members of our platform to contribute to the pandemic response, and specifically on the work required to keep vaccination services going during the pandemic. Now, here we are 8 weeks in, and we had some questions. We bet that those of you who are working every day to keep vaccination services going have had to adapt and change And adapting and change is about innovation. It's about generating ideas, testing, experimenting, and finding out what works. So we bet that by being connected to each other through peer-to-peer support, we could generate ideas, and that it could be productive to have someone from a district in one country to be able to look at ideas from other levels, from what people from health centers across that country are doing, or to look at what people from another country at the different levels of the health system are doing. And so we wanted to know, and we wanted to explore, and this is what we did in the first phase of a peer hub, what difference it might make. Now, here is kind of one of the first summary. This is kind of a dense slide, but I'll try to recap. And of course, if you've been part of the Peer Hub, I hope you will recall this and be proud of what we have done together. 96 countries, 4,567 applied. More than half of the applicants work for their Ministry of Health. 3,904 were accepted, and 2,977 started working in the Peer Hub. That was July 27th. 2 weeks later, this group had generated 1,224 ideas in just about 2 weeks across 7 thematic areas. What did we do next? We didn't stop there. Good ideas are important, but they are necessary and not sufficient. So what else did we do? We worked for 4 weeks then on developing and peer reviewing projects to take these ideas and use them to inform our reflection, our thinking, and planning our actions to do what the Ministry of Health, what our employer has asked us to do to respond to the pandemic, but to figure out the how exactly to do it. And we are, even though we have done so much in such a short time, what we have before us is, when we started Monday, on acting, monitoring, and sharing what we call the Impact Accelerator. And that Impact Accelerator is about taking those projects and over a short period, kickstarting those projects to go faster and do better in the face of the pandemic. So 3,904 participants invited to join the Peer Hub. Who were they? Who are we? And who is left standing as well? So I want to say here, I want to, of course, acknowledge all of those of you who are sending us messages on Facebook. I'll be sharing the messages in a little bit. You can see that overwhelmingly, so the majority were Ministry of Health, national and subnational staff, with a preponderant group being subnational level staff, but I also want to recognize the participation of NGOs, students, academics, consultants, and other folks in the Peer Hub. Now, the first thing we learned was about how were the professionals in the Peer Hub being affected by the pandemic? And you can see over a third of the immunization staff involved were trying to maintain vaccination services and prepare recovery. Almost a third other health professionals involved in the COVID-19 response. When we asked you what was the most critical challenge that you're facing due to the pandemic, so we got very interesting answers that aligned with the WHO Pulse One and other surveys. Caregivers may be reluctant to come to health facilities for immunization due to fear of COVID-19 infection. That was you can see, quite preponderant response. Starting out, there are 96 countries, and you can see them here by alphabetical order. You can see very large contingents from some, and you can see a number of countries that had one single representative. Now, when we asked you, why are you in the Peer Hub? We got very interesting responses in our own Peer Hub report. Participation in my country group activities have helped expand my network across the immunization space and gain more knowledge in handling immunization-based issues. That's someone from a health facility in Pakistan. I can actually broaden my vision and be more imaginative and creative towards new ideas that have come up to improve overall immunization coverage during the pandemic. These are just 2 quotes, but because there are so many of us in the room, we have prepared a set of questions. And I'm going to ask you, so again, to raise your hand. I see Aliou Salisu has already raised his hand. And I just want to, again, acknowledge a number of people in the room, especially those of you who are the lucky ones who are able to share your webcam. So let's go to Aliou Salisu. And let me put the questions back on screen. And I'd like to, of course, call on other volunteers who'd like to share to answer these 5 questions. And I'm also going to paste them into the chat for people who are in the Zoom room. Let me see. All right, here. So where do you work and what is your job? How has the arrival of the pandemic changed your work? What's the most critical, challenging? Okay, I think this is a bit of a translation
Hello,
issue here. Yes, Aliou,
hello, good
Salisu,
evening.
welcome.
I'm very happy and I'm very glad that I'm here. My name is Ali Salisu Abakar and I'm from Nigeria. Can you hear me very well?
Yes, loud and clear.
All right. I work with Federal Ministry of Health and I am a registered, I'm an anesthetic nurse.
All right, welcome. So
Can
that
you
is,
hear me?
yes,
Can you hear me very well?
yes, loud and clear. Let me put the questions back on screen. So how has the
Yeah, I
arrival
can
of
be
the
able to see
pandemic
now.
changed your work?
Actually, during this pandemic, there are so many misconceptions and there is breakout of the communication between we caregivers and the community in general. So that means that affect the immunization schedule. What I mean is people are very afraid to come to healthcare facilities for immunization processes for the fear of contacting COVID-19. And that brings about a reduction in the dropout rate. Can you hear me very well?
Yes, loud and clear. So why did you join the COVID-19 Peer Hub then?
Okay, because after I have seen the introduction from the COVID-19 Fear Hub, I know I'm going to interact with different variety of professionals from all over the world. I'm going to learn a lot of skills, knowledge, attitudes that I will put into practice so that I can be able to help myself, my colleagues, and my country at large.
Great. And 8 weeks later, Aliou Salisu, how has your participation in the COVID-19 Peer Hub changed in the face of the challenges, in the face of the pandemic? What has changed for you through
Actually,
your participation?
all right, thank you so very much. I really appreciate the question. Before I joined Peer Hub, we are having so many challenges in my province, starting from my district to my province and even to the national level. I have tried to make some amendments, but actually I don't know how to put it into practice. But when I joined the peer health, I made a proposal of my project and I make some steps. After following the steps, we now have an improvement. What I mean is the dropout rate is now increasing. People, after I put all my goals and actions into practice, people are willing to cooperate and they are willing to come to the healthcare facilities. Actually, we have had a tremendous increase in people's interest.
Okay. Thank you, Aliou Salisu, for sharing your testimony, your experience of the Peer Hub. And we'll be doing this several times. We'll hear from one or two speakers, and let me see if there are. All right, so we have, and I'll be sharing the comments. Let me go first to our next, to Dr. Tanushree Mandal.
All
Dr.
right. Thank you so very much.
Thank you, Aliou Salisu, and welcome
You are
to
most
Nushree
welcome.
Mandal.
Thank you so very much.
Thank you. Am I audible?
Yes, louder. You're a little bit faint. If you can either speak louder or increase your the volume on your microphone, that would be best.
Okay. Good evening and good evening, everybody. And I feel really, happy today to be with everybody over here. I want to share my experiences, like where do I work and what is my job. So I'm based in West Bengal, India, and I serve two roles. One is as Assistant Director of Medical Education to the Government of West Bengal, India, as well as I'm also the Associate Professor in the Department of Community Medicine in Calcutta Medical College, West Bengal. So the next question that comes over here is, can I see the question portal? Yeah, thank you. How has the arrival of the pandemic changed my work? So this is, in fact, this pandemic, I was very low. I mean, I was feeling very low in this pandemic with the deaths, the news of the deaths coming. So, and also I was listening to, the irregularities of the routine immunizations. But this course, it actually came as a God gift to me, because it not only uplifted my mind, but at the same time, it really opened a new vision for me. And I never had that thought in my mind that it has so much potential in it. I mean, we had learned from our colleges, medical colleges, but this kind of an adult learning was a really a very good experience in itself. The third thing that the question comes in is just can you see the
Yeah, so
question?
what's the most critical challenge you're facing as a result of the COVID-19 pandemic in your work, and why did you join the Peer Hub?
Yes. Yes, what are the big challenges that I'm facing in my part of the country is that the routine immunizations, they are not happening in the proper way. And because of the COVID pandemic, this has affected it a lot. I mean, it's a lot. As a result of which, this, you know, this has, helped me to delve into what are the real factors behind it. It is not only one sided, but there are many facets to it. As I went into this thing, why did I join the COVID-19 peer hub? First of all is that I'm very happy that I got selected. I opted for it, and it was a new experience for me. And this I was very much excited because I was trying to think that what it can offer in this pandemic time, and really it has offered more than what I expected. And the last is 8 weeks later, how has your participation helped into this thing? So I would rather say that yes, it has changed the thought process, and I have started inculcating the same thought in my undergraduate as well as postgraduate students, and even also in my peer faculties also, so that they can also percolate that thing on a larger scale. And this has really helped me a lot, and I'm looking forward to delve more and more. Thank you very much. Thank you for this opportunity, and I love education.
All right, thank you so much to those of you who have already shared your testimonial about your experience of the Peer Hub. I want to now take time out to honor three exceptional individuals, immunization leaders who started, in some cases several years ago, as scholars themselves, immunization practitioners who joined the course or joined the program, and who during the month of August led the first exercise of the Peer Hub. So I'd like to ask Dr. Alain Blestatsinku, Charlotte Mbu, and then Dr. Shalini Kare to each address the participants of this commencement ceremony. Alain?
Yes, good afternoon, good evening, Reda. Thank you so much. And thank you to all of you who already started this testimony. So today is really like an achievement or something. It's always good to sit down and reflect back as immunization professional or even public health professional to acknowledge a milestone. And this one is really important because we are going through hard time. We are facing an unprecedented pandemic. And we all concerned about one thing. What about our immunization program? Something that is our common passion. So I'm really happy to be here, not because the pandemic is over, but because there is a relief of working together as a team, as one team, regardless of the borders, regardless of our color, our country, our region. We were facing the same direction. We were thinking the same. And I'm happy to hear Dr. Tanushi say that the most important takeaway was to be mixed with other professionals all over the world, understand that the challenge is the same. So brother, today I'm happy. I've been here in scholar community for a while. As an immunization professional, I think that innovation is key in whatever we are doing because the world is evolving and we cannot just sit down, we have to innovate. And I'm really happy to be sitting here listening to innovators, new leaders, new thinkers. And thank you very much for giving the opportunity. I can't wait to hear what has happened. My favorite part is to hear scholar reflecting back, giving back the experience of that. Today is a festivity. Let us enjoy. Thank you, Reda.
Thank you, Alain. Thank you very much indeed. Charlotte Mbu.
Okay, thank you, Reda. And once again, good morning, good afternoon, good evening to everyone. It's with much joy and delight that I want to address you all today on the occasion of this commencement ceremony. It's been a journey, and for some, not so easy, but today we are all celebrating, and the joy is that you have achieved something. You are, and not alone. We did it together with the support of your peers. You were able to complete this exercise. So I really just want to congratulate everyone that has made it up to this point. And just to say, like Alain Blaise, that it is not the end, it is just the beginning of another phase. And I want to just exhort you, while celebrating your hard work and your efforts, just exhort you to keep up the good work and continue to fight to ensure that all children who are supposed to receive those life-saving vaccines get them, in spite COVID-19. So congratulations to everyone. Let the celebration just continue. And like Alan said, the best part of it is getting your feedback, getting you share, when you receive the certificate, saying how it all went. And we hope that within the next 4 weeks, at the end of the Impact Accelerator exercise, it will be another joy. And that we are going to continue together as a family, supporting one another, because that's what the scholar community is all about. Thank you, Reda. Over.
Thank you very much, Charlotte. I want to acknowledge Dana Sabe Usman and many other scholars on Facebook who are sending hearts to all three of you. And Dana Sabe says, Dr. Alain, you are an asset to this program. Very much indeed. The next and third asset, our latest crew member, is Dr. Shalini Kare. Shalini, what would you like to say to the scholars assembled today for this commencement ceremony?
Thank you, Reda. And good morning, good afternoon, and good evening to everybody. I am absolutely delighted to be part of the Peer Hub community, I should say. And it has been an absolutely phenomenal journey for me. I felt that with each idea and each project that I used to go through, I learned a lot. And I feel that I have developed my skills as well. And the beautiful part of this entire exercise was that feeling of oneness, and the fact that I felt that all the scholars felt that they're not alone in this hard time of the COVID pandemic, and we're all in it together. But there's this community which is so strong, and for the recovery, the actions and the interventions that they're doing are endorsed by the others as well. And there are people who are learning from each other, helping each other, and guiding each other. So I think this has been really fantastic for me, and I think it was a brilliant learning curve. So I would like to congratulate everybody on this achievement. And as Charlotte and Alain said, this is the beginning. We hope that we continue to be together in our journey in this fight against COVID and in the immunization recovery, so that no child loses his or her life from vaccine-preventable diseases. So all the best to you all, and kudos, and let's celebrate. Thank you, Reda.
We're assembled today for the commencement ceremony to celebrate the first phase of the COVID-19 Peer Hub. The idea, the call, was to assemble as immunization staff from all over the world to see how we could connect the work that each of us was doing individually to keep vaccination services going. What did the work actually consist of? So to give those of you who are not yet part of the Peer Hub, you can see here that over a very short time, starting on the 27th of July, we did 2 weeks in which more than 1,200 ideas were collected, and then spent 4 weeks actually developing and peer reviewing projects, drawing on the ideas to determine how each person in their own context could make a difference. Now, the first question we wanted to ask was, well, this was a Peer Hub about generating ideas. We launched this ideas engine. Did we actually generate ideas? And so that's a question that's easy to answer. I've already given this number several times. And you can see here the thematic areas that you identified as immunization staff, we asked you, and we got more than 4,600 responses helping us identify what were the priority areas. We then worked with the International Advisory Board to condense and distill those into 7 categories to reach this list. And you can see here the result. Let me get myself out of the way. You can see here for each of the categories. So restoring demand for vaccination through communication with communities and caregivers. That was the category which collected the most ideas and obviously the greatest area of concern for so many immunization staff. Wherever you work, anywhere in the world, this is an issue that has been very much affected in complex ways. There's no way to simplify or reduce it by the arrival of the COVID-19 pandemic. So what did you say when we asked you, what is the point of the ideas engine? This person working at the national level in Nigeria said, it's motivated me to organize my district to implement actions developed. It's also encouraged me to invite many EPI officers to learn the experiences from other countries to improve country immunization sessions. Second, at the beginning of the lockdown, a lot of locations expressed fear over the inability to use vaccines with short shelf life and power outages. Since vaccine availability was unstable with no certainty, it was a welcome idea to retrieve and redistribute vaccines to locations in need. And this is a subnational consultant writing in from Indonesia and sharing their testimony. So now I once again turn to those of you who are here who will be receiving your certificate today. You see 4 new questions in front of you. I'm going to again paste them into the chat for those of us who are in the Zoom room. And again, there are many hands raised. So I'll go to Nida Ali unless you want to lower your hand. We're asking you, what was the point of this idea engine? If you can summarize, give us an example of an idea or practice that you shared. Give us an example of an idea of practice, not your own, but something you found useful for your work. Where did it come from? Did you make a note of that? And explain how this idea of practice was useful to you. Let's go to, I didn't mean to, yes, I meant to bring Rajat Garg on, not to, let me see. All right, Rajat Garg. Oh, I see your audio has been disconnected. Let's go to Tahami Rabiu, who has a hand raised. If you'd like to take on these questions, go ahead, Tahami. You'll need to unmute your microphone. I'm asking you to do so. And let's try Nida Ali as well. And please raise your hand and then you can unmute your microphone. You don't have to request permission. Nida Ali, welcome. We'd love to hear from you.
Thank you very much, Reda. It's not Nida Ali. Basically, Nida Ali has given me the link for the Zoom. I'm Dr. Mohammad Imran Qureshi, and I'm connected from Lahore, Pakistan. And I was missing this session probably last time and happy to join you this time. And it's a happy moment for all of us because it's a moment of completion of an important activity. So I believe we are all happy at this critical time. And, very few moments where we are happy together during this COVID pandemic. So the idea which I really shared, basically the ideas were 2. I want to discuss this only one. The basic idea was to establish a proper help desk at the district level where we could have a dedicated team who could be sitting on a smart dashboards and following all the communications and coordinations downwards towards the health facilities and the communities and caregivers and parents, and the upwards with the provincial team and the national team, so as to get guidance and the updated information and just share them with the health facilities and other stakeholders along with the community in their own way. So the idea behind was basically, during this COVID pandemic, there were many challenges and many questions which were being asked by the caregivers and parents because they were damn concerned about the safety of their children, and at the same time they want to get them immunized against the vaccine preventable diseases. So they all know the critical importance of immunization. That's why they were although they were a bit reluctant because of the chances on contracting COVID infection, but at the same time they were willing and getting information how they can move forward to get their children immunized. So all those questions can be better answered from that help desk, which would be established at the district level. So previously we had a good example from polio program in Lahore. That's why this idea came in my mind, that we use such a platform in our district Lahore, and we were collecting the feedback from the parents and caregivers about the vaccination team has arrived in their home for the vaccination of their kids against the polio during NIDs and SNIDs. If not, they're gonna raise their question, and they can inform the authorities, and the authorities can make sure that they properly send the teams and the child gets vaccination. So the result was very encouraging, and hundreds of complaints were registered, and not just the complaints, there were suggestions, there were concerns, there were questions, which were all tackled technically by the team in Lahore at this help desk dashboard. And in this way, we noticed that the community acceptance increased a lot, and the coverage got resultantly increased. And in this way, like what was a missing link in the service delivery, to have a very good linkage developed between the community and the healthcare providers, so as to get the maximum benefit of the services provided. So we just bridged that gap. And the same idea was here. Luckily, in Pakistan, currently the situation of COVID is getting better and better day by day. We are opening our schools also. So all the service delivery points well established and resumed, and they are providing immunization service. The big challenge where we were like having struggle of the vaccine doses which were not being provided in the adequate number, they are now being provided in the adequate number. We are getting the defaulters enlisted, and we are covering them, and we are also using our immunization monitoring systems to bridge all those gaps. One very important thing which I want to mention is strengthening of immunization system. The vision of our great program manager, he said that this is a COVID pandemic challenge. We want to sustain the momentum, and we want to gain more. So it's the right time to build up the immunization system, and let's work for the strengthening of the immunization system. So he has worked a lot and ensured this immunization system strengthening, which will have a better results in the coming months.
Thank you so much. Thank you very much indeed, Imran. The point of the ideas engine, what's the value for you of having this, of being able to submit, for example, to share the help desk idea with others and to be able to look for ideas that others have come up with? What's the value? What difference has it made for you, Imran?
Yes, Reda, the ideas engine was a revolution. Basically, it not only providing the scholars a platform where they can share their experiences, where they can express themselves, but at the same time, it's a wonderful opportunity for other scholars to find answers to the questions which generally are not answered. And in this ideas engine, they are like exploring the ideas of the other scholars and other professionals, and then they are trying to fit in the solution into their own context. So many of the ideas I myself read were very encouraging and very motivating, and probably they were like giving a breakthrough in the thought process. So that was being used in various contextualizations in the local context, at the provincial and the district level, and even at the health facility level. And I'm sure it has a result, and that is the impact which we are all celebrating it today. So it's a combined success story, and the result is children are getting immunized, and we are saving them from vaccine preventable diseases. Over.
So the next question we looked at, and that was of interest to us, was, have ideas moved between system levels and countries? And are these ideas, impressive number of ideas, sure, but are they being shared? Are they being adapted? Are they being put to use? So that was the second part, the peer-reviewed exercise 1. And this is in French. I'll do a quick translation. So action plans, peer review, developed and peer reviewed was what this was about. Here we go. And so of all the sort of enthusiasm and energy that initiated the Peer Hub, at the Peer Hub launch, there's 700 of you, and we're going to honor the Anglophones today. We honored the Francophones yesterday. Developed and peer-reviewed plans, very specific, nourished by the ideas, referencing the ideas that you found useful. And of those, 338 were developed by Anglophones. And those are the ones that we are going to honor today. So what did you tell us about what you gained from exercise 1? You can see a quote here. Even though I'm challenged by time, I have been inspired and have learned a lot from the Peer Hub. And still learning and sharing. It's amazing that a lot of people from so many places in the world are doing so much under the cloud of COVID-19 to keep EPI services going. I'm motivated greatly to do more. So now I'd like to turn back to you and ask, what did you work on in exercise 1? What was the goal? What was your challenge? And what did you gain from peer review? Concretely, what are you going to do now with your project? I would like to go to Sani Jafar. Whoops, Sani, I saw you had your hand raised, and so you should be able to unmute yourself. Or Rogers Chai. Let's go to Rogers. Please go ahead and unmute yourself, as you're the only one who's raised his hand so far. Yes, Rogers, you are consulting with Chai. We'd love to hear from you if you could answer these. Introduce yourself and tell us more in answer to these questions about your experience of the exercise.
Yeah, good day, everyone. I'm Kani Rogers Bariture from Nigeria. I work as Chai consultant. It's been amazing. The hub has been amazing. First and foremost, I must commend the organizers. It's been amazing. At the beginning, I was thinking, will I have time for these busy schedules? But come on, the ideas kept inspiring me to look at. And it's been so amazing. So for me, the Peer Hub, before the Peer Hub, in the state where I work, Niger State, we've been having issues of vaccine stockhouse because of COVID-19. The COVID-19 actually interfered the ROI.
Yes, we hear you. So what challenge and goal did you work on in exercise 1? What did you gain from peer review, Rogers?
And often, and even the session conducted, the coverages, all the indicators were very, very poor. So in the course of our CERIC meetings, when I present this data and analysis, it became so pathetic that things were actually going wrong. So borrowing from what was happening in the Peer Hub, I have to strategically streamline my action. What do we do? Especially when there is vaccine stock out. Most often there'll be vaccine at the state level, that is the what you call the province, but at the district level and the health facility levels, there are no vaccines because health workers are not coming up to come and pick vaccines. So I begin to find out what were the issues. The major issue for where I am or where I work was issue of funding vaccine uptake from the province state coastal. So we're like, come on, with this trend of data, if this trend continues, there may be outbreaks of other disease and which may further impede the already existing health challenge based on COVID-19. So we have to look at it, look at what I was saying, and using the Peer Hub ideas generally. I can't really pinpoint anyone, but the Peer Hub ideas actually inspired me to strategically set the goals. What do we do within the next 3, 4, 5 weeks or 8 weeks? What do we do to reduce the stock out, say by 10%, so the next week by 20%, the next time by 30% gradually. So we begin to look at, okay, there are no funds, but there are some funds available for some specific and selected health facilities to take up vaccine. So can we use those health facilities funds to pick up vaccines for other health facilities that are close by to those facilities? So we map out those strategies, and it's really been helpful.
All right, thank you. Let's go back to Thank you for this testimonial about specifically about exercise 1, but your overall Peer Hub experience as well. Now,
hello, sorry, I have a network challenges. I'm back.
That's all right. That's all right. Let's progress. Now, here is a map, and I don't know how well you can see it, especially if you're on your phone, but this actually shows anytime that a scholar referenced an idea from somewhere else, that is a blue line connecting from one country to another. And you can see the tangled web of immunization staff supporting each other, collaborating with each other, inspiring each other to do more, to do better, to go faster in order to keep vaccination services going. So that is the web of the exchange of ideas. But we can even go into more detail. For example, here we have on the left-hand side, you have the different roles: National Ministry of Health, subnational consultants, NGOs, and you can see here the projects that they put together. And then on the right-hand side, you can see where did those categories get the ideas that they referenced in order to develop their own action plans or projects. And you can see here that national level staff, for example, logically got a lot of ideas from other national MOH staff, but also went to the subnational level, also got ideas from NGOs. And you can see that, say, people working on NGO staff projects also went and got ideas from across the system. So that kind of cross-pollination, that kind of exchange of ideas, I struggle to think of, especially during confinement with travel restrictions, how else this kind of exchange could happen and how productive this exchange can be, as we've been showing during the Peer Hub, during the first phase of the Peer Hub. This is showing again the exchange of ideas and how ideas are referenced inside the projects and action plans. So you can see people from districts who develop projects for their district got a lot of ideas from their district, but also from other subnational levels, from health facilities, from the national level. And that exchange, again, that cross-pollination is something that we believe can be quite powerful. Last but not least, with the databases that we'll be sharing with you soon, we have actually organized the ideas. So you can look up, say, the country of Ghana, and look at all of the ideas that Ghanaian scholars produced in the ideas engine, and then connect, see which countries' scholars used the ideas from Ghana. And you can see actually that there are more Nigerians using ideas from Ghana than there are Ghanaians. But there are also scholars from India who in their projects referenced ideas from Ghana. And you'll be able to call up any country and look at what does the exchange of ideas look like. So building on the existing ideas engine database, we have built a much more specialized and much more versatile database where if you want to look at everything that is available, all of the ideas on measles from the district level, from a specific country or set of countries, you will be able to do that at the push of a button. And furthermore, with the respect to exercise 1, so the projects that you developed, you'll also be able to say if you're looking for every project that mentioned measles, you'll be able to do a search and then narrow it down by looking at country or organizational affiliation or system level, and be able to really zero in on precisely the projects and the ideas that are most likely to be relevant and useful to you. So that is exclusively for members of the COVID-19 Peer Hub who completed exercise 1. We'll be sharing more broadly, and we have already started sharing in both French and English through the Ideas Engine Bulletin on Facebook. And you can see that actually you can see more than 77,000 minutes viewed on our Facebook page of where we are sharing with the rest of the world, so outside the Peer Hub members, about the outputs and the work being done by Peer Hub participants. You can see also, as I said in the beginning and the opening of the ceremony, that the platform has grown to 25,000 members in less than 2 months. So that is an impressive set of achievements, and I would like to offer a round of applause. However, unfortunately, Facebook has blocked our applause track, so I'm unable to do what we were able to do in previous sessions. Otherwise, that will cut off the Facebook stream. So that is the only reason. But I'd like to ask you, because there's so many of us in the room, let's see if we can do a round of applause nevertheless. All right? I'd like to see. I'm going to unmute everyone. I believe that is... let me see if I can actually ask all to unmute. All right. And so we can now hear you as soon as you accept.
Yeah.
And I'd like to ask you to
Nice.
express
Great achievement.
whatever you're feeling right now.
Congratulations.
Let's see if we can make some applause.
Bravo!
Congratulations.
Happy to hear you. Amazing.
Wonderful to hear so much noise.
There's a good tapping. Amal.
So we are on our way to presenting, to reading the list of participants.
Congratulations to everybody.
All right. Let's wait until certificates have been awarded. When congratulations will indeed be in order.
Congratulations for everyone.
All right. So I am, yeah.
Ayuru.
All right. Thanks, Ella. So yes, let's wait until we have awarded the certificates, and then congratulations will definitely be in order. But yes, indeed, there's been a tremendous amount of effort above and beyond, intended to help you in your daily work, but certainly, in fact, above and beyond what you would ordinarily be asked to do. But extraordinary times call for extraordinary measures. Now, what difference? So it's great to have a bunch of, hundreds of very enthusiastic individuals connecting to each other, maybe socializing, but what difference, if any, are made by such connections? So remember, again, we have some tangible outputs in less than 8 weeks that have been produced, and you can see them here. Furthermore, when we asked you for the Peer Hub Pulse Report to complete your first report on your experience, you can see here that 94% of you self-reported that participation has helped you improve your work to keep immunization going. 99% of you wish to remain an active member of the Peer Hub network. And if you don't see the points, you wouldn't still be here. If you didn't see the value for your work, there's no reason for you to remain in the Peer Hub. 89% of you are working on a challenge related to your daily work, and 82% say that this challenge is a priority for your national EPI team. Now, this is a little bit more complex about how the situation is changing, so I'll take it out here. But here is the clincher, is that 80% of you have been in touch with other scholars in the Peer Hub. And so there's top 3 reasons for connecting with other scholars. The top reason is actually to seek help or advice on solving a problem. And obviously a problem related to immunization services during the pandemic. That is what we hope for. That is something that we cannot be prescribed. You can connect people to each other. You cannot prescribe or order them to appreciate and work together. But that is exactly what's happening because you want to. And that is the point of the Peer Hub. Next, we asked, so what would be different if you hadn't participated in the Peer Hub? Some people might say, well, everybody would be doing, fighting to maintain, to keep vaccination going anyway. So what difference does it make to be connected in this way? So here's a concrete example from East Timor. My country team has helped me link up with senior WHO, MOH staff working on immunization. I think that's a concrete outcome at the individual level. What would be different without the Peer Hub? Here's someone from the national level in Nigeria who says, I've realized that the challenge I've identified is quite common in my country, and a good number of scholars from my country have shared ideas on how to tackle this issue. So now I turn to those of you who are in the room with this question. In the absence, if there had been no Peer Hub, if you had not participated, what would be different for you in your work to keep immunization services going? So if you would like to, I see 3 raised hands. So lower your hand if you don't feel ready to answer that question. Otherwise, I'm going to go to Samuel Malogai Badiekang. And we've got a few more points to cover, not many. In just a few minutes, we'll begin to read and award these certificates by country and by alphabetical order. Samuel, welcome. What would you like to share?
Yeah. At the onset of I'm Samuel Malugai. I work with the Certificate of Health Directorates. I work at the district level. At the onset of the COVID,
Yes, Samuel, we've lost you. All right, at least I've lost Samuel, and this will happen, and it's part of the experience. It's neither good nor bad. It just happens. Unfortunately, I don't think we'll be able to hear from Samuel. So let's go to Titu Patro 70. If you could tell us, don't forget to introduce yourself. And then Tahami Rabiu has had a hand up for a while.
Hello, my name is Geneva from Nigeria. The question is, what should be the honestly, this PIAO is very important because I generate so many ideas from what I'm trying. So also, like in my project, my challenge is provision of adequate, yes, provision of adequate and sufficient PPEs to the health workers in order to provide good immunization despite this pandemic. So honestly, I learned and also I generate so many ideas from my colleagues. So honestly, without this PIAO, without the help of this PIAO, our work will not go smoothly as possible. Understand? Are you with me?
Unfortunately,
Hello.
Tahami Rabru, I'm unable to hear you. Let's go to Titu Patro 70. Titu Patro 70, you're showing an email address as your name. Could you introduce yourself? All right, let's see if there are any additional volunteers. Otherwise, we will move on. Any more hands raised? All right, Georgios, yes. Georgios, please go ahead.
Hi, good evening. Hi, I'm Yorgos Milios from Greece. I'm a physician. What would have been the problem if it wasn't been the pandemic? I guess it would have been the same. We have a lot of problem with immunization due to the anti-immunization vaccine problem, and we're trying to deal with it. This is the major concern in Greece in this time, and that's what I think I would have done. I'm sorry, I'm facing a lot of communication issues. We had a very bad weather here, and things are not doing well. I'm hearing my voice back, and I'm not sure of what you're hearing.
We're hearing you loud and clear, so that's good. Thank you, Georgios. And tell us, you are one of a few participants from Western Europe. Can you tell us? Can you point to or give us an example of something you learned by listening to the experiences shared by participants from African and Asian countries? There's obviously significant differences in how the pandemic has played out so far and its consequences on vaccination services. What could you tell us? Is there anything you'd like to share specifically on that?
Yes, actually, we've been sharing more things than differences, Reda. I've seen that the discontinuing have been done due to the COVID. Was it exactly for the same reasons? People been afraid coming to a healthcare facility, and a lot of other things that have happened common. There was also the denial, the ignorance, and sometimes the fear of something new that is coming to the planet. That's what I thought. Yes, and of course I learned a lot of things. I've seen amazing ideas from all this think tank that we had in our armory, and I really value what you've done for us. Thank you so much.
Thank you very much indeed. All right, so let me see if there are any other additional hands raised. Anybody who has a good connection. I see some of you, such as Rita Anaba, has a working webcam. Let me see if there are other people with working webcams who are able to speak. Otherwise, let's proceed. Just a reminder, once again, remember who started, and we're now coming to the getting close to the point where we'll be getting to the heart of this awards ceremony, this commencement ceremony, just a milestone, the first 6 weeks of the Peer Hub and what was produced during that time period. You can see how we started out, mostly people from the Ministry of Health, national and subnational levels, and then NGOs, students, academics, consultants, WHO and other UN country offices, UNICEF and others, as well as other global partner country staff. You can see, again, a reminder of the 96 countries in alphabetical order and the number of participants who started out in the Peer Hub. Let me just move myself out of the way so you can give you a few seconds to take in these numbers. And let's get some little bit of music here as well, a little bit of a background. We're going to pick up the pace now because this is the first table of results that we are sharing with you. And you can see by country, the the individual numbers of certificates. So the number of participants who have earned a certificate for exercise 1. So we'll be in a couple of minutes, we'll be moving to the awards portion of this ceremony, and we'll be going country by country in alphabetical order, reading the names of those who have earned a certificate for exercise 1. If you were unable to participate in exercise 1 and you are here today, we especially appreciate your support to your colleagues. And of course, you are still a full-fledged member of the Peer Hub. You are still welcome to participate in exercise 2 that will be starting on the 2nd of November. Now, just a few upcoming things. Actually, the Ideas Engine Bulletin was something we started in August, and something that is ongoing. This is with Charlotte Mbou. Charlotte, would you like to tell us something about the Ideas Engine Bulletin? What is it, and what's the point of keeping an eye on our Facebook page?
Okay, Reda, thank you. It's just the Ideas Engine Bulletin is a platform where we get to celebrate the work that scholars are doing on the field, immunization professionals actually working within the context of COVID-19 to ensure that immunization services continue and that their performances are maintained. So it's all about you. We are celebrating you and your work and the work that you're doing. It's all about you telling us how the Peer Hub experience was and about the innovative ideas that you're using where you are to ensure that immunization service delivery is not suspended or is accelerated in spite of COVID-19. So just keep your eyes on the Facebook page. We are not usually doing much publicity of the event. So, but those who are following us on Facebook, if you're keen, you always know when we have one of those, and usually on Tuesdays to Thursdays.
So what's coming up is Peer Hub Exercise 2 on vaccine hesitancy, demand, vaccine acceptance. Different people call it different things, but that's what we're going to focus on because it is such a cross-cutting concern for everyone in the Peer Hub and immunization staff. So we will be opening up the Peer Hub again so that if you were not retained or if you did not apply for the first round, you'll get a chance at applying to join this specific exercise and to join the Peer Hub. For those of you who participated in Teach to Reach, Level 2 certification has now been set, open only to Level 1 certification holders. That's in early October. We'll be having a pilot conference to which all Peer Hub members will be invited, and that is because on the 8th of December, we'll be having the annual Teach to Reach conference, and country teams, as well as individuals with exceptional projects or exceptional stories to share, will be able to do so during the context of a fully digital conference. We'll have a plenary, we'll have rooms for workshops, you'll be able to network, press a button and connect with someone else in the Peer Hub and talk to them for a couple of minutes. There'll be lots of new opportunities and new ways to connect that you'll be able to choose to opt into or ignore if you're really too busy with end of year duties. And then what started on Monday is the Impact Accelerator Launchpad. You already know about that. So that's just to give you an overview of what is coming up and to emphasize again that we call it Commencement because it is the beginning, or rather the continuation of the Peer Hub activities intended to support you, help you strengthen your capacities by connecting you with other practitioners so you can learn from each other and work together, collaborate with people from your own country as well as people from other countries. This is what we call the procession. And this is the time when we are going to solemnly read together with Adam Blestatsinku and Charlotte Mbou and Shalini Kare. Unless one team member has a particular connection problem, we're going to be going country by country, and we'll be each reading in turn the name of a certificate holder, awarding the certificate, hoping that they are in the room, and then we'll be asking you to honor and recognize the participants from that country. So we are starting with Afghanistan, and I would like to so we had myself, Charlotte, then Alain. So let's add Shalini after Alain and before me, just to go in a round robin to read the names. So from Afghanistan, we have Colleen Hardy, to whom we would like to award the certificate for the successful completion of the first peer-reviewed exercise to keep vaccination services going during the COVID-19 pandemic from the 27th of July to the 4th of September. And that is the participant from Afghanistan. I'm unable to turn on the applause because of a Facebook restriction on such audio files. But please bring your hands together, put your hands together for Colleen Hardy from Afghanistan. Next is Argentina. And Charlotte, over to you.
From Argentina, we have Maria Monzon. Congratulations.
Great. And Maria Monzon is the sole participant, sole finalist for Exercise 1 from Argentina. We especially want to honor those of you who were the sole participant from your country and who made it to the end. Next is Bangladesh. So for Bangladesh, Alain will kick us off. Alain, are you able to unmute?
Akshik bin Iqbal.
All right. And now Shalini will read.
Mohammed Sarwar Alam. Congratulations.
Mohammed Khairul Islam.
Ume Asma Apsari.
And those are the participants. I'd like you to put your hands together for the scholars from Bangladesh who successfully completed Exercise 1. Next, we have the country of Bhutan. So for Bhutan, it is Alain's turn, I believe.
Sangai Funsto.
And that is the participant from Bhutan that we would like to commend and award the certificate for successful completion of Exercise 1. Next is Burkina Faso with a large number of Francophone participants and one Anglophone participant, Shalini.
Congratulations to Suale Kai from Burkina Faso.
And that is the Anglophone participant from Burkina Faso. Next, we have Cameroon. So I will start off to award the certificate to Barry, Asangwing, and Kemonto.
Zubila Edward.
Abel, Yannick, Gilles, Eyoné, Ebanga.
Shalini.
Video Insonencia Kualar.
Ambe Lionel Neba.
Martha Ngoe.
Solange Wegang Udom.
And those are the certificate holders for the first exercise for the country of Cameroon. Please, I want to see on the webcam some hands coming together to applaud the participants from each country. Next is the Central African Republic. I will start. Marie-Ève Burny earns a certificate as a member of the Central African Republic country team. And that is the certificates for Central African Republic. In English, I should say. There are a number of participants who earn a certificate in French. Now the country of Chile. Charlotte.
Solange Santillana.
That is for Chile. And now the Democratic Republic of the Congo, the English-speaking participants. Alain.
Alain Kikwaya Vangi.
Shalini.
Sorry, I'm having some problem viewing this, Reda, so you'd have to continue.
All right,
Apology.
Simeon Sawadogo. And that is the English-speaking participant from the Democratic Republic of the Congo. And now Djibouti. Charlotte.
Edi Alain Kemenang.
That is for the country of Djibouti. Congratulations, Team Djibouti, says Dr. Tanushri Mandal. Now the country of Ethiopia.
Amsalu Shiferai.
Emmanuel Doku.
Kifle Dimo.
That is for the country of Ethiopia. Congratulations, Team Ethiopia. And thank you to Dr. Tanushi Mandal for the messages and the applause in the chat, as well as the many messages in Facebook. Now, after Ethiopia, we have the Gambia. So we'd like to honor Abdou Jameh.
Alaji Jabi.
Koura Diouf.
Rohe Njie. And those are the participants who have earned the certificate for exercise 1 in the Peer Hub from the country of the Gambia. Now for the country of the Republic of Ghana. Abraham Aminanor Teye.
Charles Adai.
Adu Frimpong.
Afua Twomasi.
Akoswa Nima Omari Sassou.
Raymond Bedi.
Benjamin Amoako.
Bernard Badou Bediako.
Comfort Tete Dede.
David Naada Kog.
Diana Ayimpok Bila Akila.
Emmanuel Apitega. Sorry, Alain.
Eric Womerno.
Eric Asiedu Yeboa.
Eunice Yanka.
Francis Teye.
Frederick Maani Anu.
Fuseini Abubakar.
George Amofa.
Gordon Saki.
Yesi Razak Iseaku.
Doniyu Hare.
Hilarious Aziwome Kosi Abiwu.
Joseph Giebi Bouaben.
Josephine Owusu Yeboah.
Joshua Arthur.
Joycelyn Essel.
Kintor Enoch Domaka.
Magdalene Ezenan Ajoa Boama.
Ibrahim Mohammed.
Naomi Hagan.
Francis Mpa.
Obed Philippe Nuobe.
Owusu Kwado.
Oxygen Jason Wula.
Paul Angwawie.
Abbas Kwate.
Richard Adutum Asare.
Rukaya Mumuni.
Ruth Alote.
Ruth Boatema.
Samuel Malogae Badiekang.
Samuel Yahoo Atiza.
Simon Ajay.
Solomon Brefo Antwi.
Sulemana Tahiru.
Susanna Ankoma Asare.
Theophilus Kofi Tsikata.
Victor Zeng.
And those are the certificate earners for the Republic of Ghana. I'd like you to bring your hands together once again, or you can do it with a message in the chat or in the comments on Facebook. Now, let us move to the Republic of Greece and to honor our completer of exercise 1, Georgios Milios from Greece. From Guinea-Bissau, we now have Charlotte.
Stephen Osei Yeboah.
And that is the finalist for exercise 1 from Guinea-Bissau. Now, Haiti. Let's have Alain start this one.
France Garilous.
And that is the finalist for the country of Haiti. Now, the country of India. Anissa Mary Thomas Tatil.
Baba Saheb Tandale.
Bala Ganesa Kumar Sir.
Chinusera Varugis.
Unfortunately, I'm not seeing the name that's on the screen, Rena.
The next
Chirag Valia.
Dilesh Kumar.
Disha Agawal.
Amitabha Sarkar.
Pavani Divi,
Sandeep Patil,
Satabdi Mitra,
Dr. Sindalingaya HS,
Subhadip Bunai,
Dr. Subendu Kumar Ray,
Dr. Tanushri Mandal,
Tanvi Bansal,
Malatesh Undi,
Dr. Vinay Kumar Bal,
Amarnath Trivedi,
Dr. Isha Goyal,
Dr. Jayesh Mehta,
Joyiti Londe,
Kapil Singh,
Mohan Kumar,
Pathiban Shanmugam,
Brajat Garg,
Raju Tamang,
Raman Kumar,
Samarendra Biswas,
Sorav Basu,
Shriram Gozavi,
Sohini Sunyal,
Subhashani Singh,
Suresh Kumar Dalpas,
Vidisha Vallabh,
Vishwas S,
Yantin Pimple.
and those are the certificate earners for Exercise 1 of the COVID-19 Peer Hub from India. I hope you're all feeling well, and if you haven't heard your name yet, thank you for your patience. If you have, please stay with us. We have some surprises planned for the end of this ceremony. Some exciting information about new opportunities for the Peer Hub. So this is just like any award ceremony. If you're not a part of it, it probably looks tedious, maybe even boring. But if you worked hard for 6 weeks, we want to honor that effort and that commitment above and beyond to keep vaccination services during the pandemic. Now, after India, we have the country of Indonesia. And Charlotte.
Bella Dora,
Inda Musu Mawati,
Inda Rasmawati,
Jeded Mamora,
Novi Valentine.
And those are the finalists for the certificate for first exercise in the COVID-19 Peer Hub. Now, I'd like to bring Shalini back. Shalini, are you with us? And are you
Yes.
able to now see the names? Okay, wonderful. All right. So let's bring
you.
right after Alain. And let's keep going. This is a long haul for those of you, for everyone in the room, but we really want to honor you and make sure that your work and your name is read. It's a formal moment. We're doing it, defying distance to do it, with participants connected from all over the world. Let's go now to Iraq, and let's ask you, Shalini, to read the name of
Firas J.H. Al-Musawi. Congratulations.
And now the country of Kenya, Angela Kisoso,
Marigoreti Otieno,
Cynthia Morara,
Shalini,
Dorothy Logeti,
Eda Kanini,
Edgar Umar,
Helen Mwaluma,
Shalini.
Unfortunately, I can only see.
All right.
Okay, no.
We'll keep going. Sit
Elizabeth
back and
Wa-
relax and enjoy. Yes,
Elizabeth
Wambia.
Wambia.
Yep. Charlotte.
I can, when the internet is bothering Shalini, now I see only Shalini's screen.
Actually, it's
Emily
Alain's screen.
Akot,
Yeah.
Alain's screen takes time to change. That's why
Yeah.
I'm not able to view. Yeah, sorry.
All right.
So, Emily Akos. Congratulations.
Alain.
Esther Kinyaju.
Eunice Thuo.
Right.
Hassan Dakat.
Jackson Mutia.
Japheth Ndoni.
Joseph Mbari Ngugi Ngugi.
Josephine Mutai.
Joyce Washira.
Judy Gichuki.
Lucy Kanja.
Monica Gitao.
Sharon Limo.
And those are the finalists for exercise 1 for the Peer Hub in Kenya. Now the country of Liberia. Charlotte.
Kelvin Siafa Boima.
Obafemi Babalola.
Congratulations to all of the participants from all of the countries. We are now more than halfway through the list. Bear with us, just like any award ceremony. If you have worked hard, and we want to recognize and commend and honor the effort you have put in the first 6 weeks of the Peer Hub to keep vaccination services going. Many comments on Facebook. Thank you. Stay with us. We now move to Libya. Charlotte.
Ahmed Ejaidi.
Congratulations to Ahmed, as well to all the other participants from all the countries, especially if you were the only one from your country who made it to the finish line. Now, the country of Madagascar. And this one is always fun for our team. Charlotte.
Zo Herineina Patricia Razolo Manana.
And that is the finalist for Madagascar. Congratulations. In English, there are many more participants who earned a certificate on the Francophone side. Now, the country of Mali, where we have some Anglophones as well. Abraham Pudiugo from Mali. Myanmar. Mong Ye Zinzin. Congratulations.
Yin Yin Eshtai. Congratulations.
Myanmar, congratulations. And now we move to Nepal. Dipesh Shrestha.
Laxmi Marasini Akarya.
That is for Nepal. Congratulations to all of these scholars from Nepal who have successfully completed exercise 1 in the COVID-19 Peer Hub. Now we move to the Anglophones from Niger. And we have Umaru Bature from Niger. Congratulations. Now, as you know, the largest group starting out in the Peer Hub is the largest group finishing successfully exercise 1 in the first 6 weeks of the COVID-19 Peer Hub. So we'd like to honor and commend the Nigerian scholars, as we have all the other scholars from all the other countries who have made it to the end, starting with Anu Rotimi.
Abdul Alhaji Maiwada.
Abdul Karim Abdul Hakim Abdul Karim.
Abdullahi Umar.
Abiola Abdul.
Abraham Amadou.
Abubakar Babayo Abba.
Abubakar Saleh Said.
Adefunke Adesina.
Adewale Adejugbagbe.
Adunola Abosede Oyegoke.
Ahemen Tessio.
Suleiman Idris Ahmad.
Amadou Musa.
Ahmed Abubakar.
Ajay Patience.
Aliyu Abubakar.
Aliu Salisu.
Fatimo Amodu.
Antonia Nubia.
Arum Adamu Bulus.
Atai Abubakar.
Owal.
Owal Ahmad.
Bapayo Sakina.
Ochuele Barka.
Bashir Abba.
Bashir Sabo.
Beauty Jaffet.
Bilkisu Bayero.
Busola Oyelade.
Cecilia Nui Mbubasa.
Charles Ibeneme.
Chidima Ozo.
Chigozie Euzie.
Chika Ofor.
Danasabe Usman.
Daniel Dogo.
Funmilayo David.
Dr. Amma Tijani Habibu.
Blessing Agada.
Eniojo Victoria Ojo.
Ebiere Herbertson.
Anifat Omowumi Egun Jobi.
Efyong Odubong.
Ege Abe.
Victory Emeka.
Emmanuel Moussa.
Emmanuel Elebe Sunu.
Emmanuel Opetu.
Emmanuel Udochukwu Obasi.
Emmanuela Chinyonye Odunze.
Ephraim Ezekiel.
Everline Mbaisi.
Eitayo Emmanuel.
Farouk Umar Ismail.
Felicia Oluwafemi Aibi Nuomo.
Gambe Issa Muhammad.
Benga Akinola.
Gloria Archibong.
Glory Oduoji.
Glory Mwakago.
Gold Alodzie Chijioke.
Grace Omole.
Halima Sheu.
Halima Toro.
Hanifat Hamzat.
Hanatu Janada Dimas.
Hova Tense.
Husseini Abdullahi.
Ibrahim Abdullahi Maikano.
Mary Ilesanmi.
Imam Wada Bello.
Ismael Nasiru.
Isiaku Jibrin.
Itse Olayoye.
Jafar Sani.
Gebubemi Rosaline Jack Donmi.
Jamilu Yahaya.
Jenny Momo.
Iye Naomi Joshua.
Rogers Kane.
Kayode Adeoye.
Kingsley Chijioke Okeke.
Sherifat Lawal.
Loretta Ata Owokweme.
Linora Emenari.
Mala Abdullahi.
Mercy A. Onopires.
Mohamed Hamayun.
Mohamed Lawal Shitu.
Moses Obemen Akimien.
Abba Muhammad Isawa.
Mohamed Oreyin Otaru.
Muni Saleh Sule.
Mustafa Khalid.
Mustafa Mai Iyali Umar.
Nasiru Umar.
Endayo Iwat.
Seombong Ikpat.
Nuhu Sani.
Nura Musa Abubakar.
Nuruddin Aliyu.
Olajumoke Olalude.
Olanike Olai Wola.
Olani Duduyemi.
Olubowale Ukundare Famiyesin.
Olubunmi Oji.
Olofunmilola Adegbite.
Oluwaseun Odeyinka.
Omolade Omololu.
Onojo Oto.
Modupe Orulu Bagbe.
Oyeyemi Pitan.
Namdi Augustine Ozo.
Peace Saria.
Pearl Eke.
Peter Eizibolo.
Promise Izuogu.
Promise
Onaibe.
Sorry, guys.
Sorry. Go ahead, Alain.
Ramatu Usman Obansa.
Rashid Nuruddin.
Rebecca Bello.
Rita Anaba,
Rosemary Mamudu,
Sabitu Sanusi,
Salamatu Sylvia Ekor,
Sambo Ishaku,
Samuel Anjanson Sule,
Shaibu Samuel,
Barka Maman,
Tahami Rabiu,
Kamilade Adesina,
Tina Irogama Agboniyinma,
Semaye Jagdonmi,
Umar Abubakar,
Ilyasu Umar,
Usman Sule,
Usman Tijani,
Yahaya Ahmed,
Yao Suleiman,
Yazid Ibrahim Gobir,
Zaharadin Adamu Sharu,
Dr. Zenab Kwaru Mohamed Idris.
and those are the scholars who have earned their certificates for the country of Nigeria in exercise 1 of the Scholar COVID-19 Peer Hub. I hope everyone in the room is doing well. Let's see some. All right, let me first set this up so we can see how everyone in the room is doing. All right, just give me a minute. All right, so we've got many screens here. Let's see who's got their webcam still on. So we can see you. I can see Mir Arsalan. And of course, there are many of you. We just finished the certificates for the country of Nigeria. So if your country has a name that starts with after the letter N, thank you for your patience. We appreciate your patience and we're going to get there. I know there are many of you still waiting. Let us go back to the reading of these certificates. This is a formal moment, but I feel it's important to take the time to recognize, defy distance, bring together participants from all over the world, not for the purpose of the work we've been doing in the Peer Hub, but really to recognize, enjoy also, and appreciate each other. Let's now go to the country of Oman. Charlotte.
Iyad Omer.
And that is for the country of Oman. And now Pakistan. Charlotte, please kick us off.
Abdul Sami Khan.
Ahmad Navid Nusrat Shashar,
Dr. Abdur Rauf Tahir,
Dr. Muhammad Ali Mirza,
Faraz Chaudhry Sharif,
Mir Arsalan,
Mohammed Imran Qureshi,
Muhammad Mubashir Jamil,
Mohammed Taimur,
Nabila Shabir,
Nidali,
Rizwan Asgar. And those are the Pakistani scholars who have earned a certificate for exercise 1 in the Peer Hub. Now for the country of Sierra Leone. Doreen Imanyara,
Mohammed Shafiul,
Ibrahim Muhammad Kamara,
Joshua Nyarango,
Michael Ndolye,
Suleiman Fodai Mansarai.
and those are the scholars in Sierra Leone who have earned the certificate for exercise 1 of the Peer Hub. Now we have the country of Slovenia with Maja Subelj, who has earned a certificate and is the only scholar from her country who has done so. Congratulations. Next, we have Somalia with Abdelatif Sheikh Abdullahi. Charlotte?
Abdullahi Mohammed Mohamud,
Ali Elmi,
Maimuna Sheikh Abdullahi,
Mohamed Abdirahman Abdi Magan.
Nur Hamed.
Yusuf El Mohammed. And those are the scholars from Somalia who have earned the certificate for Exercise 1 in the COVID-19 Peer Hub. Now from the country of South Africa, we have Tembeka Semenya, who is the sole scholar from his country, I believe, her country. Please correct me, and apologies for making a mistake during a formal moment like this commencement from South Africa. My purpose was to commend you. South Sudan, Sylvester Malegemi.
Matthew Joker.
Chaplain Yugu.
From South Sudan, these are the scholars who have earned the certificate for Exercise 1 in the Peer Hub. Now we move to Sudan. Nada Ahmed. And that is for Sudan. Congratulations, Team Sudan. Timor-Leste, Barisa Mohammed.
Patrick Martin.
Samrawit Ejugu Debebe.
Congratulations to scholars from Timor-Leste. Now the country of Uganda, Gabriel Omoni.
Maria Nakubulwa Kibirege.
That is for the country of Uganda. Congratulations, Team Uganda. Team of one makes it even more valorous and honorable if you are the only one representing your country. We hope you will bring colleagues to the Peer Hub in the next phase of the work for those of you who have been in that situation. Now we move to the United Republic of Tanzania with Bosco Mapunda.
Green Sadru.
And those are the two scholars from the Republic of Tanzania who earned the Exercise 1 Scholar Certificate. Zambia, here we are. Obert Silwimba is the scholar who has earned the certificate for the country of Zambia. Zimbabwe, Ellen Chibika has earned the certificate for Exercise 1 on behalf of the country of Zimbabwe. This is it for the commencement procession. I'm going to unmute everyone once again so we can make some noise. Let me get everyone up on screen here. All right, I'm asking you to unmute now. And thank you to those of you on Facebook who are.
Congratulations.
Bravo, félicitations à tous.
But I told you there would be one more thing, and so here it is. I told you there would be one more thing, so you developed an action plan, and this is why we are recognizing. All right, Zoom is having some trouble here as I've muted everyone. All right. You developed an action plan in Exercise 1, and we commend you for it.
Yes.
All right, I think that's some delayed audio coming in from Zoom. Congratulations to everyone from Kuram Hassan, who's a board member of the Geneva Learning Foundation, who's attending on the Facebook. So thank you, Kuram, for sharing your congratulations. Francis Ibima, who says hi, everyone, and many, many congratulations also on Facebook, where there's still a large number watching the stream. Now, you have just been awarded a certificate for completing an action plan. So the next question before you is really, are you ready to take action? And this is where I want to tell you, some of you heard about this on Monday in the meeting about the Impact Accelerator, but this is what I want to focus on now. This is the next phase of the accelerator. So remember, we call this a commencement event because it is the beginning of something. So the next stage of the Peer Hub is reserved for people who completed Exercise 1. So we're going to be a much smaller group, but also a much more determined, committed, engaged group. And in July 2019, those of us who participated in the accelerator found a number of things, and you can see some of the testimonials here. It's about movement in the face of the pandemic, not letting down, bringing down your arms, but really raising your arms and holding hands, sharing with each other across borders with people from your country and elsewhere. There's also healthy competition. You got a sense of it today. We do report, we will be telling you how each country is doing. And some countries are doing better than others. Some countries have done remarkably well. Other countries have struggled. Whatever the case may be, we want to encourage you to keep going in the Peer Hub through the Impact Accelerator process. In July 2019, what happened? This was before COVID, before the restrictive measures on movement. And you can see these are some of the meetings. I challenge you to recognize the countries that these pictures are from. You may know some of the participants. You may even recognize yourself from all over the countries that participated in the accelerator last year. There are 644 participants. You can see here moving from knowledge to action. At the time, many scholars chose to meet in their country teams. Accelerating to do faster and better was the purpose of all those meetings. Incredible momentum and incredible will and commitment to do more and do better and go faster even before the pandemic, to really progress the immunization performance for your country, for your EPI program, and for your colleagues, and also for the children and the families that need to be protected from vaccine-preventable diseases, no matter who they are and where they are in your country. You can see many pictures here. We have our very own Charlotte Mbu receiving her certificate for completion of scholar courses from the former permanent secretary, the EPI manager for the country of Cameroon. Now, we're talking about public health. So we know you're serious about public health because of the commitment you've demonstrated. And you're probably asking, so how does this make a difference? Should I go further? I've already got a nice certificate. What's the point? You can see the answer is here. So in July 2019, we had 644 people who participated in the Launchpad. But we also had scholar alumni who chose not to join. And so we went back in January 2020 and asked both groups, comparing both groups. In red, you have the non-participants who were not in the Launchpad. So they had completed at least one scholar course, but they did not join the accelerator. And you can see at the far right, the 44% of those who did not participate in the Impact Accelerator were not doing anything with the projects that they've developed in the scholar course that they participated in. Conversely, you can see that those who had joined the accelerator, you can see that a third of them had made significant progress with their individual project. And furthermore, 1 in 8 was working on the group project. And the most impressive result was that through the Impact Accelerator process, through the country teams, half of the participants had actually joined on the country project aligned to the goals of the expanded program for immunization in their country. So to summarize, and I said this on Monday, but I will say it again now that you have just received this recognition that we feel was very important to give for having developed a project. And it goes back to that question, are you ready to do something with that project? So that is what you have before you. The Impact Accelerator has the 4 pillars. You've already made the pledge to achieve impact when you applied for the accelerator. But it's also about measurement. And measurement, not somebody tracking you or reporting on you, but actually measuring your progress and sharing your progress, successes, challenges, and learning from that together. Second is the share component. So sharing, you can see the top most valuable aspects of the accelerator as reported by participants. And at the end of the day, it's about momentum. It's about constructive competition, networking, overcoming difficulties, leveraging resources. So at the end of July 2019, basically everyone who participated recommended joining the Impact Accelerator. So that is the end of this ceremony is actually the beginning of the Impact Accelerator. We kicked off on Monday. And as you know, if you participated on Monday, we had a metaphor, a way of showing what is the intent, what is the emotion that we associate with the Impact Accelerator, which is really the next phase of the COVID-19 Peer Hub, in which more than 3,900 immunization staff from 96 countries join hands to see if we could do better by working together. So some of you already know the metaphor, but I hope you will get this. This is probably one of the greatest achievements of humankind. And the challenges may be different. Our challenges may not be about outer space, but this is what we hope you're feeling as we take off and lift off for the Impact Accelerator.
10, 9, ignition sequence start. 6, 5, 4, 3, 2, 1, 0. All engine running.